A teacher retirement healthcare seminar will focus on information regarding healthcare changes for teachers, school staff, and auxiliary personnel for retirees under 65 years of age and those over 65. The seminar is set for Monday, October 23rd, 1:30 p.m. at the Region 8 Education Service Center, located between Mount Pleasant and Pittsburgh on Highway 271. Local retired teachers lobbied for a Northeast Texas seminar, which will be much closer for retired teachers than seminars that have been scheduled in Tyler, Mesquite, Nacogdoches, or Longview. There's no need to register for this Northeast Texas seminar. Retired North Hopkins Superintendent Tommy Long, retired librarian Marilyn Powers, and Sherry Moore, wife of a retired teacher and administrative staff member at Christus Mother Frances Hospital, Sulphur Springs, spoke with KSST News regarding the seminar and the new health plan for retired teachers.
Jim, we have a seminar coming up that's going to be Monday, October 23rd. It's at 1:30 in the afternoon at the Region 8 Service Center, which is located in Pittsburgh now. And it is going to be dealing with the changes in the TRS insurance program that is affecting all retirees. Whether or not you're on Medicare, if you're an early retiree and you have TRS insurance, your insurance will be changing. There will be changes to the program that will go into effect January the 1st of 2018. This is a seminar to explain those changes and how the insurance will work after the first of the year. So there's been a lot of concern. Of course, insurance is a big issue for everyone, especially retirees who, as we age, are beginning to face more and more health problems. So, and there are changes not only in the program, in the coverage, but changes in the premiums, and so there's just a significant number of things that people are concerned about, and this will be a great opportunity for them to get information from the retirement system about the changes.
Marilyn, I understand that there had to be some lobbying done to get an event here in Northeast Texas.
Yes, Teacher Retirement System sent out flyers to everyone affected. And by the way, it's not just retired teachers, but it's also anyone who's retired from a school system. All the support staff, administrators, everybody who draws a TRS annuity is going to be affected by this. So yes, when we got our flyer from Teacher Retirement System, it said you could sign up for these seminars, but they sort of forgot Northeast Texas in our opinion. The closest ones we could go to were Mesquite or Tyler, and those were rapidly filling up. We happened to be at a district meeting of the Retired Teachers Association last Thursday, and we mentioned that Northeast Texas, needed one of these seminars, and they were good enough to add one for us next Monday. But they don't have time to send out all the information, so we're trying to get it out by word of mouth. And please spread the word to anyone who may be affected.
There is no registration for this, Jimmy. It's just if you choose to go, you're welcome to attend. The flyers that were sent out, you had to pre-register or were supposed to pre-register to attend those. But this particular seminar doesn't require registration. They made it available. And so it's just open to any eligible person. And like Marilyn spoke, TRS doesn't just include teachers per se. It includes any staff, bus driver, custodian, anyone who is eligible for an annuity from the teacher retirement system. Yeah.
Spouses of teachers are also people who should be interested in this. And Sherry, I know that you kind of have a twofold interest. One as the spouse of a retired teacher, and the other as a representative of a hospital system. So let's talk just a little bit about what kind of changes we're looking at here.
Sure. The retired teacher that's on Medicare will automatically go on Humana Medicare Advantage as of January 1st. That does impact my husband, who is a retired teacher. So on January 1st, that will be his health coverage. He does not have a choice, neither do the other teachers or support staff that are on that are retired and on Medicare already. So they will be put onto that particular plan. The good news is our affiliation with Christus Mother Francis and Christus Mother Francis in Tyler and Christus Health has allowed us to participate in Medicare Advantage plans. In the past, the hospital has not participated in those. But the good news is we are. And as of 9/1, we actually are on the Humana Medicare Advantage plan, and there's a United Medicare Advantage plan that's available in our community as well. And so we're on both of those plans. Christus, our hospital, and then Christus Trinity Clinic. So all of the providers that work for Christus Trinity Clinic will be in network as well. So that is a positive thing for everyone that's making this change. It is different. It is something they've not had before. So there are my advice to everybody is really understand what you're getting and how it's going to work for you, and you're going to have to advocate for yourself. There's going to be some things that you're going to need to do a little bit different than when you were just on traditional Medicare and a supplement. Traditional Medicare and a supplement, they just paid. You had a little bit of deductible that was there, but they took care of your bills. This is different in that you will have some amount that you owe for your doctor visit, for your hospital stays, those types of things. They did, though, and Maryland's quick to educate us on this and keep us in the loop. They did, however, draft a different Humana Medicare Advantage plan for teachers. So it's a little bit different structure than what you'll see on a traditional Humana Medicare Advantage. So there is going to be some costs to teachers. Not only have the premiums gone up, I'm experiencing that obviously, but not only the premiums gone up, but there will be some out-of-pocket costs that teachers will incur with Humana Medicare Advantage. There will also be pre-authorization that's required for certain procedures and for hospital stays. That's all new for this group. That's all new because with a Medicare and a supplement, you didn't have those types of things. We as a hospital understand that, so we'll do most of the pre-authorization. But again, I kept cautioning the retired teachers last week when I spoke, own your own health care and own your own insurance and understand what you have. It's better to call and be told, oh, you didn't need to call us, than not to call and there be a problem and then you have to pay something. So
Marilyn, what are some of the differences as it relates to, that she's mentioned a few things, but specifically differences in the Humana plans?
Well, my understanding, but I need Sherry's help on this, is that the premiums are rising. They don't look like they're going up real drastically for the person who was the educator. It is going up quite drastically for any educator's spouse that was on our plan or as a supplement. So that's one of the changes. The other thing that is of great concern is if you leave the TRS plan, the educator or the spouse or anybody else in the family that leaves will not have access to come back.
correct.
So that's why we want people to have all the information
Right.
possible while they try to decide if they're going to stay with the state plan or if they're going to go into the market and talk to insurance agents or companies and try to get something on their own.
Okay.
Yeah, I think that's very important that people understand that if they leave the TRS insurance, there will not be an option to come back. They will not be they won't have that opportunity.
School systems in Hopkins County, from Sulphur Springs to North Hopkins to any of the other school systems, the school systems in this county are in many ways the largest employer that we have here in the county when you sum them all together. And so that puts a large number of those retirees in this area, does it not?
Yeah, curiously, we were given this information last week. This is the newest state update. And I wanted to share with you, I didn't do this a while ago, but in Hopkins County, there are, I was a little surprised, there are 718 annuitants, which mean they're getting a check from the TRS system, that have Hopkins County addresses. But those 718 receive $15.2 million annually in payments. So that's how much retirement money is coming in
So the economy is affected by retired
I
teachers.
would think,
Yes.
I would think that is a fairly significant amount. I mean, it's, you know, that's how many retirees we have that are eligible or they're receiving an annuity payment and their amount of payment on an annual basis.
Right.
They come into the county, so.
Our state organization tells us, as they worked with the legislature this last year on all of this, that the average annuitant from the teacher system gets $2,000 a month. That's the average
Okay.
when you take across the board. And so we don't qualify for cost of living increases or anything like some of the Social Security beneficiaries do. So when you raise premiums and you raise deductibles, it has a big impact.
Yeah,
Yeah.
yes.
Does.
What kind of percentage-wise do we know how much that increase is going to be in the premium?
I don't know percentage-wise, but right now, for example, I'll use my husband. He pays, with the plan that he's on, he pays $100 a month. That's going to go for him to $135 a month,
Wow.
okay? And he's still going to be paying his Medicare part, you know, one's free and one you have to pay for.
Right, Part
So
B.
he's still going, he's still going to be paying for that. And so if I was to be added to his plan today, the way that it reads, it would cost us altogether about $535, $533, somewhere in the over 500 range. And then we both would still have the Medicare on top of that, which would be, you know, well over $700 a month for us both to have coverage. So again, you're at some point when it's time for me to retire, I'm going to have to do the math because I don't want to leave the system until I really know for sure
Right.
that's the wisest decision. What my big caution is you have mass numbers over here with TRS that will help hopefully to control some of the rise in premiums. If you jump over to a supplement, there's going to be increases over here. You're not going to have that number, so there may be some increases over here that you have no control over. So again, I think it's the thought you can't go back that really is makes you hesitate.
Yeah, Jimmy, the premiums, like mine's $105. It's based on how many years you taught.
Correct.
It's based on when you retired. We have some people who are paying like 85 that have been retired for some significant time. But the way I understand it is the new premium starting January 1st is going to be $135 for everyone,
Okay.
regardless. So if you were paying 85,
It's
you're
really
going to
an increase.
135. If you were paying 105, you're going to 135. So some of those people who have been retired for a significant number of years are going to get a big increase. It's
Yeah.
really hitting some of them pretty hard, and that is in addition to their Medicare. Obviously, they have
Right.
whatever that might be. So it's hard to say what percent. Like mine is, you know, about a third, but some is going to be
Even
maybe
more.
as much as 50% increase.
And if you have a spouse
And the
who's
spouses.
being covered under your policy,
Then it's a big
or
increase.
a family member that's being covered under your policy, it's a much bigger
It's
increase.
much more significant. Yeah.
Again, this seminar is going to be Monday
Yes.
and tell us again.
At Monday at the Service Center, Region 8, which is located on Highway 271 in north of Pittsburgh, at 1:30. There'll be representatives from, I understand, from the insurance company and TRS, who will be there to present at the workshop.
And the time again?
1:30.
1:30.
1:30.
All right.
No registration, no pre-registration. If you have an interest, you just show up.
And if you have a teacher friend in Northeast Texas,
Yes,
let
be
them
sure you
know.
tell
Let them
them.
know.
That's
Yes,
right.
yes,
That's right.
yeah.
Thank y'all very much
Thank
for
you
being
for
here.
having us.
Thank you.